I'm all set.
We are live.
A very good evening, everyone. Welcome to iFocus Online episode 308, Ocular Oncology module number 15. And today we have with us the grand quiz of Ocular Oncology, which is an open quiz competition. And our quiz masters are Dr. Mrittika Sen and Dr. Rolika Bansal. A brief introduction of both. Dr. Mrittika Sen did her MBBS from GS Medical College and KEM hospitals in Mumbai in 2015, and post-graduation from Dr. RP Center, AIMS, New Delhi, and a long-term clinical fellowship in ophthalmic plastic surgery and ocular oncology at Center for Sight, Hyderabad, under the mentorship of Dr. Santosh Navasar, and her research fellowship in ocular oncology from Wills Eye Hospital, Philadelphia. She's an assistant section editor of ophthalmic plastic surgery and ocular oncology in IJO, and section editor and author of the IJO column Tales of Yore. Currently, she's a consultant in ocular oncology and ophthalmic plastic surgery at Raghunath, Netralaya, Mumbai. And our very own Dr. Rolika Bansal, who needs no introduction to the iFocus audience because she has been a part of iFocus from its very inception. She is currently wrapping up her fellowship, long-term fellowship in Center for Sight, Hyderabad, and going on to the sheets for her ocular oncology training. A very warm welcome to both of you, and over to you.
Thank you very much. I would just like to add one thing that this is from the inception, it was Mrittika as well. So the originals would be Mrittika, and we both have been there throughout. So it's like her first. So that's all. Okay, so hello everyone. Mrittika, would you like to say something?
No, this is quite exciting to be on the other side of the quiz this time. So I hope all of you enjoy it. I hope all of you find it exciting, and let's have a good time.
Yes, well, I would just like to add one thing is that Mrittika always dislikes to be on the other side. And I think this is the first for her. And also, she's the one who made me excited about the quizzes. So it's kind of fun to be her co-quiz master. So to everybody, I would just request the fellows to please log out from Zoom so that it is the same platform to all. And we will be having this entire thing displayed on YouTube and Facebook as well, and you guys can log in to kahoot.it, and that is where you will be putting in your game pin. I'm just sharing my screen to show you the game pin. So this game pin is what you're going to be using, and you can use your devices. Like you can use two devices. I mean, like if you want to really hear the explanation as well. So it will be available for you on the YouTube and the Facebook portals. Is the audio also coming, Sunilji?
Yeah.
Okay.
So this is the game pin.
Yeah.
Go on.
Okay.
So this is going to be the initial round, and we have a set of 25 questions, following which the top 5 will go on to the next round. So then we'll send you the Zoom link where you can join in the panelist section. Rolika, do you want to continue with the rules?
So this game pin is 2535592. We might just have a little bit of like delay because it gets put on the social media a little. Yeah. So now people have started joining, and you can use this game pin. This game pin will be available for all of you for like at least the next 10 minutes. And just a brief about the quiz. So 25 questions, as Dr. Mrittika has told. Those questions will be available to you for 20 seconds each. And after 20 seconds, we will have a leaderboard display. We might just keep the leaderboard display to keep up the enthusiasm. And after that, the 5 people who top will be taken up for the Zoom platform. And that would be the live quiz where we will have 2 rounds. One round will be for the radiology round, on which there will be 5 questions given. and that will be a buzzer round. So in that round, you will have to say a yes on the chat box, and whoever says a yes first goes in for getting the marks. So it will be plus 20 and minus 10 for the radiology round. For the progressive round, that is a very interesting and different kind of round, made and perfect for ocular oncology setup. So that Mrittika would like to explain.
Yeah, so in the progressive round, it's not going to be the fastest finger first or anything. We'll give a question to each of the participants there, and we'll be showing you one figure at a time, and you can guess. I'll explain the rules once again before we start that round. This is while we are waiting for the others to join. So here we'll be showing you progressively 4 different pictures. And from that, you'll have to guess the tumor or a condition that's related to ocular oncology. And yes, there will be negative marking, but there's also a chance to pass it on. If you're able to also add what the connection is between all the 4 pictures and how are they related to the final answer, you'll get bonus points for that. Right?
Right.
So we have a lot of participants who already joined. I did see somebody called RRR here.
Everybody has pretty interesting names. I can see multiple people who are joining who have been chronic quizzers. It's good to see all of you pop up again.
Is SH who I think is SH, or is it not?
I hope not.
I don't think so.
If it is the SH that we are thinking about, then he will not be allowed on Zoom platform. Will be banned from the same.
So we are waiting for about a minute or so more, or 5 minutes more for.
So it till around 8:12 at least we will wait a little bit. 8:10 is what we had declared, but since people are still joining, we will wait up for till 8:15 maybe, because there's a lag, so it's easier for them to join.
Okay.
So on your Kahoot app, there will not be a lag, but what you hear online, there will be a lag. So approximately nearly there's a 2-minute lag which you see. So if you want to hear the explanation going on in the background, you can always do that, because we will be giving a pause and we will be giving a little bit of explanation. So that will help.
But if you want to answer the question, read it on the Kahoot app.
Yeah.
And answer. And how much time are we given? Are we giving
20 seconds for each
20
question.
seconds to answer?
Yeah. And just a disclaimer, these are a blend of easy and tough questions. It's like every quiz has to have certain questions which are going to be, which are going to pep you up, and there are questions which are going to make you think, and they've been designed in such a way so that the postgraduates have a take-home message in every question. So you all will enjoy for sure. Can wait for like 5 more minutes, and then we can start off.
Yeah.
I think people are facing some login issues. They're logging back in and forth. So
yeah, right.
Yeah, you can even log in directly on your on the www.kahoot.it or with the app. You can always download it and keep for future quizzes also. So how does it feel, Mrittika, to be on the other side?
Exciting, but not so exciting, I guess.
There was always an MS in the list, okay. She has not just been a chronic quizzer, she's always been a chronic quiz winner also.
No.
Yes.
So is this the last of the ocular oncology segment on iFocus?
Right. We have the next segment. To be revealed soon. However, the next class will not be on Wednesday this time. It will be on Friday. So the pattern will be shifted back to Wednesday and Friday. And on this Friday, we have a very interesting lecture by Dr. Vijayanand Reddy sir. and he will be talking about radiotherapy and chemotherapy. So a little bit of things which you might not be exposed to in your setups. So it will be a new, completely new spectrum to hear about. We have individually learned a lot from Dr. Vijayanand Reddy. So you will actually experience a different world in that lecture.
RRR is no longer there.
When to take the Oscar. So another like 2 minutes and we can start off.
So we have ruthenium, we have...
I was about to say that RU has become ruthenium now.
Interesting.
I like how the most obvious people have put their names with maximum deception, that they should not be known.
So how many of these names do you recognize among the chronic quizzes here, like in iFocus?
Dr. Aishwarya, Dr. BJ, because that is JB sir, and that is Dr. Kavya is there, Dr. Gautam, Dr. Divya.
Okay.
Dr. Tasmia has been a part of iFocus here and there, of course. In the quiz, I'm seeing her for the first time, so that shows her interest in ocular oncology, I suppose. And I have, these are the ones which are, yeah, Deepika is there, and Dr. Abhigna. That's great. So good to see all the names. Yeah.
So we have 39 participants till now.
Correct. So we start off in another 30 seconds, and
Okay.
those who would like to join in the middle also, you can actually cope up, I'm sure.
Yeah. I'm sure you're going to find this really easy if you have attended all the lectures.
Yeah, so all the questions have been made in a way that they're from the lectures. So that makes it easy. I see Dr. Ashwita pop up. Dr. Parth is also chronic quizzer, if it is the path that I think he is.
Okay.
Great. So let's begin the quiz.
All right. All right. So I'm going to read out the question. Each of us are going to go alternately. And all right. So here goes 3, 2, and 1.
Just a second, huh?
All right. That's the question.
Yeah. These are just the quiz rules for a brief. So round 1 will be 25 questions on Kahoot. And the top 5 will be invited to join on Zoom. We will be sending you all the link. So when we declare the top 5, I'll give them my phone number. You can always log in and we'll send you the link. And the radiology spotters will be the next 5 questions is the round 2, and round 3 will be progressive round. Radiology spotters are going to be buzzer round, first fastest finger first, and progressive round is a set per person, and the quiz masters are always right. So yes, you will not really get much time to Google them, and it's all based on what you've heard till now. So over to you, Dr. Mrittika.
All right, let's start with the first question. So identify the condition that's shown in this picture. Your options are retinoblastoma group E, choroidal metastasis, Coats disease, and retinopathy of prematurity. Okay. All right, the time's up, and can we have the right answer? Okay, that was close. So 14 of you have answered the right answer, that's Coats disease. So if we can just go back to the picture, you'll see that there is exudative retinal detachment. So all the yellow thing that you can see, these are subretinal exudates with bullous retinal detachment. And you see these vessels there at the end, you can actually see they're highly in the periphery, they're tortuous, they're dilated, and they're terminating as light bulb telangiectasia. Now that's characteristic of Coats disease and not retinoblastoma, although it's a close mimic. All right, so this is something that you all should be able to differentiate. Let's go on to the next question then, Rolika.
So the next is the leaderboard.
Subcutaneous at 913. And we have SP, BJ, Dhanalakshmi, and Rakhi. And I'm sure that this is going to be a really dynamic board. So we can move on to the next question then.
Yes. So the next question is, the following are the definitive clinical examination findings in the disease shown, except. So which of the findings is not a definitive clinical examination here? Rose Bengal staining, pigmentation on surface, a prominent feeder vessel, or presence of keratin. Which one is not the definitive clinical examination? Okay, so that's actually good. So a lot of people got it right, pigmentation on surface. So as you can see in the media over here, the pigmentation on surface is present. So this is ocular surface squamous neoplasia. And the lesion often stains with rose bengal because that shows the tumor activity. And a prominent feeder vessel, as you can see on top, will be seen in these lesions. Presence of keratin, as you can see inferiorly, will also be seen. And this lesion is overlapping onto the corneal limbus. So there is a possible corneoscleral invasion as well. Pigmentation on surface may be present, but it is not a definitive clinical examination finding where you can pinpoint and say that, yes, this is ocular surface squamous neoplasia. So let's see how dynamic the leaderboard has been. Great. So we have new names popping up. Dr. Amol, Dr. Aishwarya, and SP and SC are fighting for the first and second position. So the next question.
So select the odd one out in relation to the image shown below. Belzutifan, photodynamic therapy, 3P loss, and lymphangioliomyomatosis. So you have to pick the odd one out. 3, 2, and 1. So let's see the answer. Okay, that's good. So 19 of you have got it right. It is lymphangioliomatosis, leiomyomatosis. So the picture is that of a retinal capillary hemangioma or a retinal hemangioblastoma, which is also seen in the syndrome von Hippel-Lindau syndrome. So belzutifan, I'm sure all of you would know, and you will be asked in the recent advances as well. So this is a recently approved drug for VHL-related cancers, including renal cell carcinoma, CNS hemangioblastomas, as well as peanut tumors. Photodynamic therapy is, of course, a mode of treatment for the capillary hemangiomas, and 3P loss is the genetic finding in these patients. The answer here, lymphangioliomyomatosis, that's seen in cases of tuberous sclerosis and not VHL. Okay.
Right.
So let's take a look at the board. Oh, is that changing or is it the same one?
It's changed a little bit.
So we have SC back on top and Amol is on fire. All right. Let's go on to the fourth question.
So the next question is, the occurrence of this lesion is known to be associated with the following syndromes, except. So take a good look at this picture. Which of these syndromes are not associated with this particular lesion? Charge, Veta, faces, or scalp. They all stand for an entire syndromic presentation. So I hope you all know that. It's good to see quick answering happening. Okay, so I do agree that this is a little difficult one. And facies is the right answer. So faces is basically associated with the cataract, coloboma. And the picture here, you can see this is a conjunctival dermoid that is overlapping onto the limbus inferonasally. inferotemporally, sorry. So here you will be seeing in faces will be association of cataract, coloboma, sclerocornea, microphthalmos, optic nerve hyperplasia as well, and peripapillary staphyoloma, and also capillary hemangioma of infantile, that is infantile capillary hemangioma. So yes, that is the right answer. And 13 of you got it right. This was a tough question for all of you. So let's see how the leaderboard goes up. So we have SC at the status quo, and Deepika and Dhanalakshmi have come up good. So Deepika and SC have like 2 marks difference, and Amol is still right there. And let's see what happens with the next question.
All right. So which of these cases is most likely to have intrauterine or early postnatal or neonatal retinoblastoma? So you can see those images, and A, B, C, and D have been marked. So pick out the one which is likely to be present in a neonate. Okay. So a lot of people have joined later, 44 answers. And majority of you did get it right. It is D, and I think all of you know the reason why. Because the earlier, the younger the child, the tumor is going to be at the posterior pole or the fovea. So in the neonate, it's going to be close to the fovea. However, as the child grows, the new tumor that appears is going to be further away from it. All right. All right. Let's see the scoreboard then. And it's more or less stable, but Divya has moved up 11 places. So maybe they are going to catch up.
Yeah, and SP is trying his level best to pop up. Great. So the next question is, the following are true for the lesion displayed in the picture, except. So this is the lesion that you can see. And which one of this is not true? It's often in V shape. No known malignant potential, requires aggressive treatment, and autosomal dominant disorder. Again, an honest disclaimer, it is a tough question indeed. Okay, I am amazed. This is great to see that 17 of you got it right. Yes, it requires an aggressive treatment. It does not require an aggressive treatment, and the lesion is hereditary benign intraepithelial disc keratosis. As you can see over here, it occurs in V shape, which is most often a presentation. It occurs bilaterally, and it could be nasal or temporal as well. And it does not have a malignant potential. The treatment usually is observation as it spontaneously regresses, and however in the smaller lesions it can be excised locally, and surface reconstruction can be done with AMG or MMG. And yes, it is an autosomal dominant disorder, and you must look at the buccal mucosa in these cases. So let's see what the leaderboard says.
So you know what, while I had the chance to think about it, I think I can guess who SC and SP are. Suddenly, it's not subcutaneous and status post anymore.
Yeah, it's status quo, I believe. So this is good. So good. I think apps is climbing up the apps.
All right. Next question. What is the retinoblastoma group as per ICRB in the given picture? This is a very easy question. C, A, B, or it cannot be grouped. Quick, quick, quick. This one is an easy one. After a series of difficult ones, we win. Absolutely. So nearly all of you got it right. It is group B. So this is a very important classification, which all of you, I'm sure you know it. So this is group B, which is less than 3 millimeter from the fovea. Okay. All right. I think we can show the leaderboard. I don't think this requires any more explanation. All right. Ashwita is back on the leaderboard.
And ruthenium is the highest climber. So moving on to the next question. The intralesional drug used for the management of this lesion is derived from what? So this is the lesion, as you can see. Is it derived from Streptomyces nodosus, verticillis, venezuelae, or griseus? I believe it's an easy question.
I thought you were going to read out streptomyces for all of them, and I was thinking if you can finish within time.
Okay, I did believe it's an easy question. So Streptomyces verticillis is the right answer. And this is a venolymphatic malformation. As you can see that there is a level that you can see in the lesion, which indicates it is striking of venolymphatic malformation. And Streptomyces verticillis is what bleomycin is derived from. And it was in 1962 that Umezawa was the one who derived bleomycin from Streptomyces verticillis, and he published it in 1966. Nodosus, however, is amphotericin B, and venezuelae is chloramphenicol, and griseus is streptomycin. So moving on to the leaderboard. I'm kind of enjoying how SC and SP and Dhanalakshmi, they're all like, they constantly know the answers. I think they were attending iFocus pretty
Five players
diligently.
lost their answer streak. I'm sure you all can make it up. We have lots of more questions remaining.
It's written tough round. Okay.
So what is the treatment of choice in this case? Is it plaque brachytherapy? Is it systemic chemotherapy for a primary lesion? Is it observation or PDT? That's photodynamic therapy. So we've shown you the fundus photo, the OCT, the ultrasound, as well as the autofluorescence. And the answer is plaque brachytherapy. So let's see the media once. This is something that you need to differentiate from a benign condition. That's a choroidal nevus, which you can observe. But there are signs which can help you detect which one is more towards even a small lesion. Is it likely to be a melanoma, or is it likely to turn into a malignant melanoma even from a nevus? So this lesion actually has almost all the characteristics in terms of the presence of orange pigment, the subretinal fluid, the hollow on ultrasound. So I'm sure all of you know the mnemonic: to find small ocular melanoma, do imaging. Okay, so that's what you need to remember. So this needs to be treated with plaque brachytherapy. Okay, so SS is there and Dhanlakshmi is on fire.
Nice. So the leaderboard is quite dynamic, except for the status quo on top. So the next question is the 3 TV series shown here. One of the following disease is in common. So this is a trivia question. Which of these 3 fancy series, which I'm sure that all of you must have seen or have been watching, feature one of the following diseases in common? Melanoma, congenital lymphoma, VHL, or retinoblastoma? I hope this is an easy question. Yes, indeed, you all are right. Von Hippel-Lindau is the disease which is featured in all Gray's house as well as Bones. I don't have much of explanation for the trivia question. So moving on to the leaderboard.
Nice. All right.
So this is great. Divya Ramraika is the highest climber. Great, good going.
So identify the eyelid lesion that's shown in this picture. Is it a melanoma, a basal cell carcinoma, an intradermal nevus, or an inverted papilloma?
Are you allowed to give such easy questions, Mrittika?
I am. Okay, so very good. I'm impressed. Most of you got it right. It is an intradermal nevus. So this lesion has the characteristics of a benign condition. You see, there is no loss of architecture. The lashes are intact. It's just a pigmented, well-defined condition that's been there. The patient will tell you that it's been there for years and has really not changed. You can just observe this. Okay.
Right.
Okay.
So 3 players just hit the answer streak 5, courtesy Dr. Mrittika. That's great. So moving on to the next question, the following medications have been used for topical treatment of the lesion shown here, except. So which of the medications are not used for this lesion? Cidofovir, mitomycin C, interferon alpha 1b, or 5-fluorouracil? So another 3 seconds left for this question. So yes, it was a tricky question, and
That's just cruel. That's just cruel when you do that.
So the cidofovir is indeed used for topical treatment. In fact, it was one of the initial ones that was used, and it was interferon alpha 2b, which is the correct answer, which is used for topical treatment, and this is 1b. And yes, it was a little cruel, but this is an easy question if you try to just pay attention to the little details. So let's see what happened to the leaderboard. So ABV was definitely holding on. So yes, it's not about getting the answer fast. It's also about getting the answer right.
Select the most appropriate treatment for the condition shown. Is it incision and curettage, excision biopsy plus frozen section, hot fermentation plus azithromycin ointment, or marsupialization? See, I give them easy questions.
See, we are alternating with easy and tough questions, right? Good cop and bad cop.
Excellent. So it is excision biopsy and frozen section because this is a sebaceous. Can you just show the media for them? So this is a sebaceous gland carcinoma, and you do not want to do an incision curettage. You do not want to just observe it. This has all the features of a malignant lesion. So marsupialization is basically for benign cystic condition, especially like lacrimal duct dacryops and all. So yeah, that's the correct answer.
So Mrittika is just being nice to everybody. I see like suddenly the leaderboard goes on moving when Mrittika asks a question. Okay, so moving on to the next question. The cells shown in the light microscopy picture are seen in which disease? So I think my job was to take the tough questions. So this is the picture which shows the light microscopy of which disease? Schwannoma, retinoblastoma, xanthogranuloma, or HTLV-induced adult T-cell leukemia. I think I am playing the bad cop. So these are two-tone giant cells that are seen in xanthogranuloma. And retinoblastoma does not have two-tone giant cells. In fact, those are rosettes that you can see over there. And HTLV-induced adult T-cell leukemia actually has flower-shaped cells. So xanthogranuloma is the right answer. And let's see what happened to the leaderboard.
Yes, SC is down and SP is up. That's like a huge difference here. It's changed.
So definitely SP has been going to histopathology, I believe, and then Lakshmi and Deepika, yeah, you guys are also constantly there.
Which of these is false about the condition shown in the image? It is the most common benign periocular tumor in children. It may be associated with MAHA. It undergoes spontaneous regression. Glaucoma and seizures are the other components of the triad. Ooh, okay. So 15 of you, it's a win-win here. Okay, so basically 15 of you answered glaucoma and seizures are the other components of the triad, which is the correct answer because that's associated with Sturge-Weber syndrome. The condition shown here is capillary hemangioma of infancy. It is the most common benign periocular condition seen in children. MAHA is basically microangiopathic hemolytic anemia. And so the natural course of this disease is that it does undergo spontaneous regression in about 70% by the age of 7, in almost 80 to 90% by the age of 10 to 12 years old. But in some cases, they need to be treated, the eyelid ones, because they can cause amblyopia. So that's when they require treatment. Other systemic conditions more commonly that can be associated with it are Casaback merit or faces. All right.
Right. So let's see what leaderboard has.
Gautam is there on the leaderboard.
And MJ is the highest climber. Right. So the next question, that is the 16th question, is identify the lesion shown here. See, now I have come up with an easy question right here. Just identify the lesion that is developed here, that is hemangioblastoma, retinoblastoma, astrocytoma, or a tubercular granuloma.
It's relative, easy and difficult.
I am being I'm kind of looking into it because I know that's a tough question. So I was trying to be nice. So this is a retinoblastoma. I do believe, and I agree that many of you would like to say astrocytoma, but astrocytoma will have backshadowing more than what is seen in this lesion. So this is kind of involving all layers and growing out of them, and that is a retinoblastoma. And let's see what has happened to the leaderboard here. I think it's like status, like the two people who have answered were probably
SQ, status quo.
Yeah, this is excessive status quo. We are actually playing good cop and bad cop here, I believe. Over to you.
So what is the treatment of choice? Is it excision biopsy with a 4 millimeter clear margin with frozen section, excision biopsy with base cryotherapy, observation, or none of the above? Right. All right. So see, majority of you got it right, and you are really, really good. It is excision with base cryotherapy. This is a small lesion of molluscum contagiosum. So you would just want to excise it. You don't require any clear margins in this case. It's mostly seen in children. You avoid RF cautery because there's a risk of spreading the virus. All right.
Right. This is also status quo, right? But yes, everybody answered it. So the next question is, what is the next best step after the clinical examination of this patient shown here? So after you're done with the clinical examination, what would you like to do next? You would like to do hot fermentation and conservative medical management, or a radiological assessment, or a multi-level incisional biopsy, or an excision biopsy with intraoperative frozen section. So I finally got to be the good cop. Yes, it is the radiological assessment, and all of you are right. I'm glad to see this. This is actually a dermoid which had probably ruptured, and therefore you can see the redness that has come over the lid. So that red component is because of the dermoid rupture. And hot fermentation is not what we go for. We have to see the exact depth and exact location and exact radiological findings of this lesion. So the leaderboard kind of stays the same, and it's SP, SC, and then Lakshmi, ABV, and Gautam. However, SS has had a streak of 3 answers correct in a row. Over to you.
What is the current edition of AJCC classification that's being followed for staging of eyelid tumors? Is it the 10th edition, the 7th edition, the 9th edition, or the 8th edition?
I think Dr. Mrittika made sure that she takes up all the easy questions.
Oh, no.
The good cop.
I just feel that people should want to answer. All right. So that was a close call. But again, just like 17 of you got it right. It is the 8th edition that is being followed currently. And that's for the staging as well as the pathological staging as well as the clinical staging. Okay. So bottom has moved up.
Okay. So the lead singer of the band Alabama Shakes suffered from a childhood malignancy. Which one? And this is the picture of the person who suffered from the childhood malignancy. Was it rhabdomyosarcoma, leukemia, neuroblastoma, or retinoblastoma? Well, 9 of you got it right, and this is Brittany Howard, and she suffered from retinoblastoma in childhood, and her one eye is enucleated, and she also won the Grammy in 2021. So it's quite an achievement and an inspiration for many who are suffering from retinoblastoma. So let's move on to the leaderboard. Gautam has got it right and is in close follow-up with SC.
All right. As per the World Health Organization Global Initiative for Childhood Cancers, which pediatric cancer is not a tracer for initial focus? Is it Burkitt lymphoma? Is it neuroblastoma? Is it retinoblastoma or Wilms tumor? All right. So very few of you got it right. It is neuroblastoma. So this was an initiative by the WHO. This is just to help as a guideline, and the primary aim is to bring down or improve the survival in childhood cancers to about 60% by 2030. And they have included 6 childhood cancers which have a good outcome, a prognosis. That includes Burkitt's lymphoma, you have ALL, you have Hodgkin's lymphoma, and then you have retinoblastoma, Wilms tumor, and low-grade glioma. Neuroblastoma is not included in these 6. However, it does not mean that they're not focusing on these tumors. These are just to get appropriate data.
Right.
Okay.
So Gautam, has moved up.
Him is the highest climber.
Him.
So we need a her as well.
So the 22nd question is, the light microscopy shown here is characteristic of which disease? Solitary fibrous tumor, xanthoma, rhabdomyosarcoma, or lymphoma? Mrittika, what do you think it looks like? What is this appearance exactly like?
It just reminds me of arachnophobia. I'm not sure.
Okay, so these are actually spider cells, and 15 of you got it right, that they are seen in rhabdomyosarcoma specifically. So let's see what the leaderboard says.
Gautam is on fire.
And he's got 6 answer streak, right? That's great. It's quite an achievement.
Okay. Which best describes the mutation that's seen in the subgroup of retinoblastoma patients with these characteristics? These include a young age, unilateral disease, aggressive histological features, and lack of chemosensitivity to standard chemotherapeutic agent. Is it MECAN amplification RB1++, MECAN amplification RB1+-, MECAN amplification RB1-, MECAN ++ RB1? Okay, so yeah, the correct answer is MECAN amplification RB1++. This is a rare subtype of retinoblastoma seen in about 2% of the patients. Now, normally, as we know that it is the RB1 gene that is defective in patients with retinoblastoma, where there is loss or inactivation of RB1. That's shown as RB1-. But in this kind of a variant, you have the RB1 gene is normal, but you have MECAN amplification. And these subgroup of patients are actually younger in presentation as compared to unilateral retinoblastoma patients with RB1 mutation. Majority of them end up with primary enucleation. They're not very chemosensitive. So that's something that you need to keep in mind.
Right. So Mrittika did take up the lead on the bad cops questions, right?
Okay. This is not moving, is it? This leaderboard.
Isha got it right. So at least you know one of those two people who got it right. So the next question is, who pioneered brachytherapy for ocular tumors? Was it Rees, Ellsworth, Stallard, or Moore? And the hint actually lies in this picture. So if you can correlate with this particular picture, you will be able to correlate with who pioneered brachytherapy for ocular tumors in general first. So great. It's good to see that many of you got it right. It is Moore. And R. Foster Moore was the first one who used radon, and that was used for the treatment of ocular tumors. However, Stallard was the first one to give the brachytherapy for retinoblastoma. So great, great.
I think, is it the last question now?
Yes. So next question will be the last question.
All right. So according to the European RB group guidelines, which is an absolute indication for secondary enucleation, is it regressed tumor covering the optic nerve, tractional retinal detachment, refractory disease despite salvage treatment, and obscure tumor view? Right? Let's see the answer. This is really, really good. So many of you got it right. So this is refractory disease despite salvage treatment. So this is a recent guideline by the retinoblastoma group. Do we have the media in this?
No, I couldn't attach the media.
That's
here.
okay. So this is a good paper that was published recently in the Cancer's Journal, and I think you all should read it up. It basically gives guidelines for absolute indications and relative ones. So relative is when you can still attempt conservative or salvage therapy, provided that the parents understand the risks involved and the child is going to follow up. However, if it's a refractory disease despite salvage treatment, that comes under an absolute indication. Right?
Right. So let's get ready to see the leaderboard, and I will be showing the top 10 as well, because there might be some changes that we will have to make. So the leaderboard shows the third position is by SC.
SC.
The second position is by Gautam R. And the first position is by SP. This is great. And we also have runners-up, that is Dhanlakshmi and Rani. But this leaderboard is going to change. I'm just going to share the entire podium as well. So just give me 1 minute.
All right. But these guys played really well. I think the three of them were consistently in the leaderboard.
Right.
Oh, we have difficult questions.
So I'm just stopping the share screen so that I can open the leaderboard, as we might have to make few changes.
Yeah, but I hope you all enjoyed yourselves, and we had fun making these questions.
Right. So I'm just sharing my screen again to show you all the final report. Just a second. So these are the top 10. Just a second. Yeah. So these are the top 10. On the 10th position, we have SS. On the 9th position, we have SH. I wonder who that is. And 8th position is Dr. Ashwita. 7th is Dr. RU. 6th is BJ. 5 is Rani. 4 is Dhanlakshmi. 3 is SC. 2 is Gautam R. And 1st is SP. So I would just like to, Mrittika, would you like to say something? So I would request the first 8 to please come online on Zoom. First 8. Yeah.
So we'll be sending you, I think the link has already, they have
No.
the link.
So my phone number is 8826612008. So please send me a message on WhatsApp and I'll be sharing the link with you. The first 8 have to join in. That
and
is
please send in your complete name.
Yes.
So we can identify you correctly.
Right. And that would be SP, Gautamar, SC, Dhanalakshmi, V, Rani, BJ, RU, Ashwita. And if any of you have the link from before on the Zoom, for the Zoom platform, you can please join. Otherwise, ask me for the link again. I repeat my number: 8826612008. So those of you who have this, please go ahead and join. I'm sending you all the links as well. Would you like to say something in the meantime, Dr. Mrittika?
So I understand that for the PGs, ocular oncology is not something that you all are really exposed to, but through iFocus, I'm sure many of you have developed interest in this really, really important subfield. The other thing is that we have a lot of people joining in. This time we spoke about it, and then we thought that we would encourage the PG students to probably win. And while our fellows have done really, really well, it's maybe a request that we allow the 5 PG students who are on top to finally compete in the final round.
Yeah, Rani, you have still not sent me a message. Others have sent a message.
But well done, guys. You have done well. Once you join, we would also request you all to identify yourselves with your complete name.
Rani, the number is 8826612008. Please join soon. Send me a message.
And turn on your videos. I don't know. What do you feel, Rolika? Should we allow the 3 of them to?
I really don't know.
They did not know the questions at all, and they played well.
They did not know the questions, and I'm so proud of all 3 of them. It is that since they have been the hosts, that's why the decision was taken.
Oncology fellows.
Yes. But I'm extremely proud of all 3 of them, and these were great answers. And you guys stayed up and answered amazing. But it's as per your decision, Dr. Mrittika. What would you like to do?
Let everyone join. Let's have, if we have those 5 candidates here.
Okay, let's do it that way. So you guys
and
can
hopefully they are also PG students. The other top 5. Then
Dr. Gautam, would you like to introduce yourself? And Dr. Dhanalakshmi, please come on.
Good evening, everyone. I'm Dr. Gautam. I'm third-year resident from Jipmer, Pondicherry.
Okay.
Okay, great.
Hi, ma'am. I'm Dhanalakshmi from Indira Gandhi Government General Hospital from Pondicherry. Third-year DMB resident.
Okay.
Okay, great.
Good. This is BJ. Can you just type out your full name? That will be helpful for us to identify during the quiz itself, and turn on your video, please.
Dr. Rani, if you have any difficulty, please let me know. Otherwise, Dr. SH can also join.
Since it was not one, we know that it was not the SH.
Definitely not the SH that we are thinking about. But 8826612008. I request Dr. SH also to join, and then we can take a decision on the same.
Hi, sir.
Hi.
You are a chronic quiz winner. So happy to see you here.
But not in a direct Viva, basically.
You need more lessons from Peruz, ma'am.
It is easier to answer when you have 4 options, Otherwise, you have to rack your brain to come out with a patterns. Correct. And Dr. Rani has joined, madam? Dr. Rani?
Not yet, sir. Dr. Rani and Dr. SH have not joined. Dr. Ashwita is having some difficulties in joining.
So, the fellows, do you want to give your feedback about the quiz?
The winner will give the feedback.
Dr. SP, we are actually quite proud of you that you maintained, and Dr. SC had like a complete streak in the beginning. She got like all the questions back to back, right? So
Histopathology and syndromes killed me. No, I'm
It's
happy.
actually great to have those bundle of questions like a mixed bag. But I was thinking I would not do the trivia part and the question where one of the Hollywood celebrities was involved. I was definitely not up for it.
yeah, you're the old retro Bollywood that you are. Pretty Howard definitely did not cross your mind.
We would request the other participants to kindly join quickly because we are kind of running a little short on time.
The classes were extremely great. Let me tell you, the classes, it was almost like doing a fellowship under Sandosh. Really great, actually. Lot of things. Maybe I am away from oculoplasty for 5 years because Feroz has come and joined me, and she is the one who looks after my oculoplasty patients. So then I am totally away from oculoplasty. So this was sort of going back to college and learning, or rather going back actually. It's really great. The class, I think, Rolika, it's absolutely fabulous.
It's really nice of you to always participate on the quizzes. You always make sure that you're online and participating. That kind of teaches us to keep up the spirit at all times. And you never fail to be a part of it, and we actually enjoy that the most. This is
I teach my children not to learn to lose also. In a common in a platform, like you cannot win all the days. Once in a while, you should also lose. That is one message I would like to give to my children, my students. And age is no barrier for achieving anything. That is what I believe.
Dr. Rekha Raj Shivaraju, would you like to unmute yourself and introduce yourself? Was that Dr. SH?
Rani madam has not joined, is it?
Yeah, so we're just waiting for them so that.
Let me call her 1 minute. Find out.
Dr. Rekha Raju, yeah.
You can switch on the video.
Hello, ma'am. I'm Ashwita.
Yeah.
Okay. The name is stored as different name.
No problem,
Let me
Ashwita.
call
I'll
her.
rename it. And
Video, please. Yeah.
Ashwita, I would request you to switch off the background that you
Switch
have.
on the video.
I think
Hello,
you
ma'am.
have-
I'm Ashwita. Yeah.
Ashwita, I request you that there are 2 devices around you, right? So you can switch off the other device. You have logged in successfully here. Probably it's kind of messing with your bandwidth also. Okay. Can you hear us, Ashwita?
Yes, ma'am.
Okay, perfect. Great. So you can switch on your video as well. And introduce yourself.
I think my video is on. Just give me a
Okay.
second.
Yeah. You can just introduce yourself.
I'm Dr. Ashwita. I'm a third year postgraduate from STM Medical College, Dharwad.
So we have 1, 2, 3 residents, 3 fellows, and Vijay sir. So how would we like to go about it? Dr. Rani has not joined.
Has to join, right? Dr.
Yeah, the 9th person, the Eighth, no, the 9th person has joined. The 5th person was Dr. Rani, who has not joined. Or shall we go ahead?
I think she has some connection issue, Rolika. Please go ahead.
So we have here 3 PG students, and so we have
I actually
potential
just
participants.
fun. I'm very happy to give my position to the PG students because it's like so amazing that they could answer after like doing a full fellowship. We could answer all these questions, and these guys are like really answering so amazingly. Well done. So I'm happy to give my place away.
Dr. JB, would you want to participate in this quiz?
I don't mind losing actually, Mrittika. But I'd like to go through this.
Right.
Doesn't mind. It doesn't matter actually. You can.
So if we don't have anybody else joining, do you want to give a chance to the youngest of the 2 fellows and the 3 PG students here?
So what
That I will do. And if you think you want one more PG to join, Mrittika, please go ahead. I'll stand down.
No, sir, you can please be there.
Yeah. But I will not participate.
The quiz,
Okay.
Request so that we can allow the younger ones to try and win.
Definitely. Sure.
So I think for the
sir.
spirit of the quiz, I think I would like everybody to participate in the first round, including Dr. Shefali and Dr. Subhav and Dr. Rojo. I know you guys are the hosts, but you guys have done well. So let's have you all participate in the first round. That is a buzzer round. So 7 people go in for it. And then after that, whoever are the top 5 go on to the progressive round. Okay. Is that fine with you, Dr. Mrittika?
That makes sense. So one of you will drop out after the first round of radiology. Just a second. You want me to share the slides?
2 will drop out.
So we have Shefali, we have Ruju, we have Subhav, Gautam, Dhanalakshmi, and Dr. Ashwita. Dr. PJ has kindly decided to step down for the younger participants, but we would request you to remain online for the quiz, sir. If that's
Definitely.
Thank you.
Right. So next is going to be the radiology round.
Right.
And in the radiology round is like a buzzer round. So you have to message on the chat box and immediately you have to send a yes. If you send a yes first, that is when I will be taking that particular person only. So it will be plus 20 for the right answer and minus 10 for the wrong answer. And let me repeat that nothing that is from the beginning is being carried forward. So it's just a fresh platform for everybody, including all the participants here. So we go on to the first question.
Sorry.
Yeah. So on the chat box, as you can see, you can select the chat box message as everyone in the meeting. Okay. And as soon as the question pops up, you have to say a yes on the chat box. And that is when I will mention the particular person's name and that person will be required to tell the answer. Okay. Negative marking is there. It's minus 10. Correct is plus 20. Okay. So the first question.
Okay. Sorry. Okay, so this is the radiology round. It's the radio, we like to call it the Radio Gaga round. So here's the first question for you.
The first question is a 23-year-old girl presented with unilateral proptosis since 1 year. So what is the best management option in this particular disease? So the first yes that has come from is Dr. Subhav. Please go ahead and tell your answer. You can say
using agents.
And Gautam, would you like to answer as well? Gautam?
Sclerosing agent.
Okay, and Dr. Shefali? Dr.
Okay,
Shefali?
I think we can give them the answer because I think there's going to be. So who gets the minus point? Only one of them?
So
If it's
let's have three answers and then
Fine.
we can decide. The first person who gets it wrong gets the minus answer. The rest of
Right.
them are pass. So Shefali, would you like to answer? You won't be getting negative marking if you answer. If you get it right, you'll be getting plus 20. I think she has chosen not to answer. Okay, so Subhav, can I go to the answer, please?
Okay. So the answer is
So the answer is excision biopsy biorbitotomy, not a sclerosing agent. This is a very well-defined lesion. It's probably a dermoid or it could be any mass lesion. It's a very well-defined lesion sitting nicely there. You can actually go ahead with a subbrow orbitotomy, anterior orbitotomy, and go around the lesion and take it out in toto. So it's an excision biopsy, and Dr. Subhav gets a minus 10.
okay. So let's move on to the next question.
So what is the most probable diagnosis in the image shown here? Would it be an aneuploidy, mucormycosis, medial wall fracture, or an orbital extension of the ocular surface tumor? So the first person to text is Gautam.
Orbital extension of ocular surface.
Okay, and then Lakshmi.
Ma'am,
Then
option A, NSOID.
And Dr. Subhav.
Option A, NSOID.
Okay, so this was a very tricky question. And Gautam, can we move on to the answer, Mrittika? Yeah, so the answer is a medial wall fracture. It was a very tricky question again. So Gautam gets a minus 10. And the medial wall fracture, because it's the weakest part, that is the lamina peperacea. And this is actually a trapdoor which has led to, can you see the lateral rectus here? The way to identify is out how the medial rectus, how it is housed into the, through the lamina peperacea. That does not happen in aneuploidy or mucormycosis or even the orbital extension of ocular surface tumor. The answer is medial wall fracture. So moving on to the next question. Which one of the following is false regarding the disease in the image shown? And that is, it presents in the first or the second decade. More than 50% are associated with neurocutaneous disorders. NF1 associated lesions are more aggressive, or female predilection is seen. The first person to answer was Ashwita. Ashwita, what would your answer be?
Option D.
Okay. And Gautam, what would your answer be?
NF1 associated lesions are more aggressive.
Okay. And Dr. Shefali?
C, NF1 associated lesions are more aggressive.
Okay. So you guys are right. So it would be minus 10 for Ashwita and plus 20 for Gautam. So neurocutaneous disorders, like over here, you can see is an optic nerve glioma, and it is present in the first or the second decade. And more than 50% are associated with neurocutaneous disorders, and that is neurofibromatosis mostly. The lesions which are associated with NF1 are actually less aggressive, and female predilection is seen in these cases. So good job. I think it was a good attempt by Gautam. And we have Ashwita with minus 10. Moving on to the next question. So in the image shown, the following complications that must be kept in mind would be, except, that is a possible rupture, underlying periosteal tether, perineural invasion, or a fistula formation. So the first one to answer is Dhanalakshmi. Dhanalakshmi, what would your answer be?
C, perineural invasion.
And Dr. Shefali?
Perineural invasion.
Okay, so I'll just go on to the answer that is right, perineural invasion. This is a well-defined dermoid, and it's a very thin walled lesion which can undergo a possible rupture intraoperatively. An underlying periosteal tether can be seen in this because you can see a very broad base. And in these patients, if we don't treat it well, a fistula formation can occur. But however, fistula formation mostly occurs in a dumbledermoid. But perineural invasion is definitely not seen in these lesions. So that is right. And that gives Dhanalakshmi a plus 10, plus 20. Moving on to the next, is that 5 is right. So at the end of this is when we are able to make a decision on who goes for the I think Dr. Subhav is right now wondering that silence is speech is silver, silence is golden. So Dr. SP is at minus 10, Gautam is at plus 10, Dr. SC is at 0, Ashwita is at minus 10, and Dhanalakshmi is at plus 20, and Ruju is at 0. So that takes us to the top 5, and that would be Dr. Dhanalakshmi, Dr. Gautam, and Dr. Shefali, Dr. Ruju, and am I right? And who am I missing?
I think these guys are tied at Ashwita and Subhav.
So we give Dr. Ashwita the opportunity. Dr. Subhav has already done his level best for the quiz. Good job, Dr. Subhav. Is that fine, Dr. Subhav?
Yes, Dr. Rolika. Thank you.
You did great. You definitely did great. But Ashwita is a resident who could match that level. So we'll go ahead giving her the opportunity. Fine. The score will be carried forward now. So that is plus 10 Gautam and Shefali 0 and Ruju 0 and Dr. Dhanalakshmi 20 and Ashwita is minus 10.
Okay. So now the next round is called Know Thy Tumor, which is the progressive round. So here are the rules. I'll be showing you 4 images one by one. So you'll have a minute to answer for the entire question with all the 4 images. And these all point to one tumor or an oncological condition. If you guess the condition with the first image itself, you get plus 40. If you can ask me to move on to the next image if you're not sure. And with the second image, you get plus 30. With the third image, you get plus 20. And with the fourth image, if you guess the correct answer, it's plus 10. If with any of these you answer incorrectly, you get a minus 10. But at the end of it, if you do give me the correct answer and you're somehow able to tell me how are these 4 images related to the condition, then you get a bonus of 10 points. If you don't guess or you answer incorrectly, we pass on this question to the next candidate who begins with the image that is shown there. Okay, and if the next person gets it right, depending on at which image number he's able to answer it, he'll get that many points. Again, this is going to be, we'll call out the person who's supposed to answer. Do not answer out of turn, otherwise then you lose that question. Is that okay? Do any of you have any questions?
If you have any confusions, you may ask now so that we can clarify it.
I will be showing you a sample question so that you get an idea about how we are going to go about it. And in the sample question, any of you can attempt it. Okay. So here's the first image. So this is actually a movie poster. This is clue number 1. It's a movie by Shyam Benegal. Would any of you like to attempt this? Again, this is not going to be counted.
Dr. Subhav, you are allowed to answer here.
And this is not related to a tumor. It's just a sample question.
Dr. Jayaprasad, sir, you can also take this question. This is specifically made for both of you.
If not, I'll move on to the second clue. Okay. So the second clue, this is a hilly place, destination.
The Darjeeling.
Okay, but I'm not looking, I'm not asking you the name of this place. they're all correlated. So you have to remember the first image and this, and then find the common link. Okay, I'll move on to the next one. So
you still did not get
I
it?
don't know if he wants to answer. Yeah, Ruju, you were saying something.
Ruju, you don't have negative markings for this one. You can say it. It won't be counted. Come on, try even if you're wrong.
There's no negative marking. Anybody who wants to give an attempt. This is not related to a tumor. Don't think in terms of tumor. Think about the movie, think about the place, think of this image. Rolika?
Even I don't know the answer to this.
Related to some song, I think, but I don't know which one.
It's like in Vadiyon mein Junoon and Chhatri. I don't know what is Dr. Mrittika.
Now here goes the final clue. Please tell me.
Oh,
Okay, come on. Somebody has to answer this.
he's the blue umbrella.
Yes, so who's this person?
Bond.
Thank
Bond.
Ruskin Bond.
Ruskin
Yeah,
Bond, but
yeah.
the girl with the blue umbrella.
No, so the first movie was one of his books that was adapted into a movie. That's The Flight of the Pigeons that was adapted into the movie Junoon. The second one was the picture of Story where he lives. Blue Umbrella is one of his most famous stories.
Oh, so the answer is Ruskin Bond.
The answer is Ruskin Bond. I showed you his picture in the end.
Okay.
And his house, and he still stays in the house there. So we have stocked the house.
So if you guys are ready, I think we'll start with Dr. Dhanalakshmi.
Yeah.
Dhanalakshmi, are you there?
Oh, yes, ma'am.
You're ready for your question?
Yes, ma'am.
Okay, so here's your first clue.
Switch on your video, please.
Are you switching on your video? Yeah, all right. So you can choose to answer it. Now, these are going to be related to some tumor or ocular oncology condition. Okay, so think like that. So here's your first question.
Okay.
This is the first image. Do you want to attempt or move on to the next image?
It's neuroblastoma.
You're attempting that answer?
If you're attempting it
yes,
and you're
ma'am.
incorrect, it directly goes as -10.
I'll take that as an attempt.
Yes, ma'am.
Okay. So I'm going to pass this question on to the next person, Dr. Gautam. Are you there?
Yes, ma'am.
Do you want to attempt?
Yes, ma'am. It is neuroblastoma, the sign raccoon eye sign.
Okay. When we pass on the question, I'm not keeping a negative marking. It's only for the first person. Now it's open to the other participants. If any of them would like to attempt or ask me to show the next picture, maybe. Would anybody like to attempt? Or do you want me to show the next picture? One of you has to.
Next picture.
Next picture. Okay.
She's kept the tough level highest.
Who is this person?
I can think of Wolverine.
Okay. Shefali, do you want to attempt?
I'll go with the next image.
But okay. That's histopathology section. Shefali, it's your
Ruchu,
turn.
you don't have to type yes. You can just say the answer. The yes part.
Shefali, I'm going to give you the chance to answer this one.
Ma'am, can I go again once?
I'm sorry, you're done with your chance. Shefali, do you want to attempt this, or do you want me to allow Ruju or
I would also go with neuroblastoma raccoon eye sign. So neuroblastoma is the tumor.
Raju, you would like to say?
Amyloidosis.
Okay. All right. So here's your final clue. And I think everybody has answered this.
I'll try one.
Here is your final clue.
This is
Dr. I will ask you for the answer in the final round, but you're not going to get points for this.
Okay.
Sorry, can I answer? Hedgehog.
Okay. Who wants to answer here?
Yeah,
Shefali?
basal carcinoma. The first picture was of a hedgehog. So it's a hedgehog path inhibitor. Which
Rodent ulcer. That's a rodent.
basal carcinoma.
Okay. So both of you did get the answer correctly. Shefali gets +10 because she answered with 4 images. It is a basal cell carcinoma. Okay. It is also known as rodent ulcer.
Hugh
Gautam, you
Jackman had
also
this.
got it correctly. It is right. So, all right. So if I go on to the first image, that is actually an animal called Wolverine. It's not a raccoon. It's not a hedgehog. It's an animal called Wolverine. Of course, Hugh Jackman did play Wolverine, but here's the association.
He had basal cell carcinoma.
Correct. Exactly. So he's had 6 surgeries for basal cell carcinoma. Absolutely. This is a pathology section showing basal cell carcinoma. And this is a clinical picture of a lower lid basal cell carcinoma. So just to confirm the scores at this point.
That would be Dhanlakshmi gets -10 and Dr. Shefali got +10.
+10. All right. Okay. So the next one, Gautam, that's for you to attempt first. Here's your first image. You can choose not to answer. You can ask me to show the next image. But if you answer and it's incorrect, it passes on.
Next image.
Okay.
Next image.
Okay. So here's clue number 3. What image is this? What kind of imaging is this?
And the answer is choroidal metastasis.
Okay. The question passes on to Shefali next, who's next in line. Do you want to attempt?
Can I have the next image?
I know somebody's jumping in the audience to answer and regretting the speech.
You're passing?
1 second. Okay, I'll pass.
Okay, so the question now passes on to Ruju. Do you want to attempt? Pass. Okay, it's open to the house. Anybody wants to attempt?
Subhav, do you want to answer?
If I attempt, I'll get negative marks if it's wrong or.
No, right now it's open. You're not going to. I've shown all the images. It's okay. Ashwita is still left, right? Ashwita can get it. Ashwita, it's your turn. Do you want to attempt?
Astrocytoma. I don't know.
Okay. Dhanlakshmi, do you want to go for it?
Is it CHRP?
All right. So
Subhav, do you want to answer it? He is jumping.
Yeah.
Look at him. He's like.
Go on.
So the first image of giraffe is giraffe sign. And this is a case of B dump.
Right.
And that is lava
me
lake
the full form.
appearance, bilateral diffuse uveal melanocytic proliferation.
Perfect.
And the image which was shown is FFA, which is kind of called as a lava lake appearance. This has been published by Dr. Padmamalini Mahendra Das, one of the articles.
Okay, so while you're right about that, this image is of an autofluorescence,
Autofluorescence.
not FFA.
Yeah, FA.
Okay, and who's this?
He's like, I got it at the giraffe. I don't care.
You got it. You got it. So this is Dr. Cornel Gass. He actually gave the 5 cardinal features of B dump. Okay. So that includes the reddish patchy lesions in the choroid. Then you have SRF on ultrasound. FFA, you have the hypo and hyperpigmented lesions. You have the progressive, rapidly progressing bilateral cataract in these cases. So these are the signs that he described for B dump. All right. Okay.
Right.
So here,
Dr. Gautam gets a -10, is it?
and nobody gets any points here. Okay.
Yeah.
Moving on to the next round, it is going to be for Dr. Shefali. This is a question for you. Are you ready?
Yes, ready.
Okay, so this was the answer for this.
I'm not very good at people's faces. Next
You
one.
can say pass. Yeah.
Yeah, next.
You want me to next image?
Yes. Starry night. Okay, next one.
Next image.
Burkitt's lymphoma.
Absolutely right. So you get +20 for that. Do you want to attempt correlating the images here?
Okay, the second image was the painting by Vincent van Gogh, which is called the Starry Night. So what we see in histopathology is a starry night appearance in Burkitt's lymphoma. Okay, and the third image is of a proptosis. I can see right eye proptosis with the bony erosion and dural, basically extension to the dura. So that gives me a clue at lymphoma. First one, I'm very bad with people's faces and images, so I don't know.
So basically, the first picture is that of Dr. Epstein.
Epstein-Barr virus. Okay. Yeah.
He
Okay.
described the association of EBV with Burkitt's lymphoma. And the second image is that of Dr. Dennis Burkitt. Described Burkitt's lymphoma, especially in children in Central Africa. Interesting thing about this is his right eye is prosthetic. He lost it to a trauma in childhood. So these are the 2 people who are associated with this tumor. And this was, of course, the 4th and the final clue. So here, Shefali, you get +20, but I'm not going to give you the bonus 10 here.
Okay. Yeah, because I missed the first one.
Right.
Fair enough.
So this was Burkitt's lymphoma. It's a rare tumor. It happens mainly in children. There are 3 variants: sporadic, endemic, and you have the immunodeficiency associated. Okay. All right. Oh, I'm sorry. We have Ruju.
I know the answer. Next one.
Go on. Ruju.
So she has to give the answer of the tumor, right?
Yes. Or a condition associated with it. You can choose to move on to the next image.
Next image.
Sorry, I didn't get that. Did you say anything?
Next image, please.
Okay. So clue number 2.
Reverse of Ota.
Okay, but I want you to correlate the 2 images and give me the name of the tumor I'm looking for here. This is nevus of Ota. You're right about that, but I don't want this. I don't want you to identify this image. Do you want to attempt? Do you want me to show the next picture? Do you want to pass?
Next picture. Choroidal melanoma.
Good. So this is choroidal melanoma. Do you want to attempt correlating the images, please?
Basically, this is a picture of B scan, and OCT image shows a elevated choroidal lesion, and it is associated with nevus of Ota.
Rather, nevus of Ota can be associated
Associated
with
with
this is an oculodermal melanocytosis. So you have to check these patients for uveal involvement, uveal melanoma. And why did I show this picture?
Because she had
no idea.
melanoma.
She had cutaneous melanoma, which was
Melanoma.
metastatic. So this was only pointing towards melanoma. So you get plus 20 here, Ruju. Okay.
Yes.
And this was, of course, the final clue. Okay. All right. Next, who do we have? Ashwita, are you ready for your question? Okay. Here you go.
I know it's Freddie Mercury, but I don't know. Next.
Okay,
Next.
very good. Who are these two scientists that I've shown in
Next.
the image? Did you answer anything?
No, ma'am.
Okay. Do you want to attempt?
I get a -10 if I answer wrong,
Yes.
right?
Yes, yes. But
I'll
I
go for
think
the
you
next
know
one.
the answer. You'll go to the next one. Okay.
Kaposi sarcoma.
Excellent. Are you the one who answered? Is that Ashwita only who answered?
Yeah.
Yes.
Perfect. So you get plus 10. And do you want to tell me how are these images related?
Freddie Mercury had Kaposi sarcoma. I don't know.
Okay.
Or he had HIV.
Excellent. And who are these two scientists?
They probably found out one of the histopathological signs.
So,
I don't
so Ashwita gets plus 10. So yes, she is right about the fact that Freddie Mercury did have HIV. Then his other bandmates started this Mercury Phoenix Trust to help patients with HIV. These are not scientists. These are actors. Tom Hanks, Denzel Washington from the movie Philadelphia. That did where AIDS was one of the central theme. Okay. This is eyelid involvement by Kaposi sarcoma. It is a violaceous, almost, angry red lesion. And of course, this is the conjunctival involvement. So you are absolutely right with your answer. This was Kaposi sarcoma. So I think we're done.
Yeah.
Just go for the, do you want to total them, Rolika?
I have it ready.
Question to the audience, whoever wants to take it.
Okay, go ahead. I'll total them.
Yeah, okay. So this anybody can attempt. Is
capillary hemangioma, strawberry needle.
This is
Okay.
Weinstein.
Wine.
You're right.
Sturge-Weber syndrome.
Who answered that?
Me.
Me is Subha.
Yes.
Okay, so what is the tumor that's associated with it, Subha?
Sturge-Weber choroidal hemangioma.
Right. So this is
So the person who does not even drink is getting it right in one shot.
So it's there, and the clue is there. It's port wine that's there. That's the stain that's associated with it. Then you have the gonioscopy picture that shows blood in Schlemm's canal, which can happen with elevated episcleral pressure. You have, of course, the ultrasound showing the diffuse choroidal thickening. It is, although they can have both circumscribed as well as diffuse choroidal hemangiomas, but classically the one that's described is a diffuse choroidal hemangioma. This is, of course, the clinical and the FFA picture showing lacy early hyperfluorescence. So this was a choroidal hemangioma, and all of you did very well. I am quite impressed. So
Yeah.
I'll just sharing the slide and allow Rolika to announce the winner.
Right. So the third position is by Dr. Dhanalakshmi. So the cool part is that both the rounds kind of played a role here. Okay. So the second position is by Dr. Ruju. And the first position is by Dr. Shefali. And I can see Dr. Ruju's expression is like, really? What do you think? So just to clarify, the first, Gautam, you have done really well. The first, like in radiological investigation, you were the one who was coming second, right? So it was plus 10, but you got a minus 10 that brought you to 0. And Ashwita had a minus 10 and then a plus 10, so got it to 0. Dr. Shefali had a plus 20 and a plus 10 that gave her a 30. And Dr. Dhanalakshmi had a plus 20. In the first round, you were the one who got it all right, and then minus 10. So that became plus 10. Okay. And
to Ashwita, Gautam, and then Lakshmi from my side. Because in residency, I really did not know anything about ocular oncology, and these guys are so awesome. Well done, guys.
Congratulations to you too, ma'am.
so so great job, everybody. And I must appreciate Dr. Gautam and Dr. Ashwita and Dr. Dhanalakshmi.
Yes, very well done.
Being residents, you guys are like technically the winners for from all of our sides. And Dr. Mrittika, would you like to say anything?
No, so I'm just impressed that all of you played really, really well. And I'll just ask for some feedback from you. And then I think we can call it a night. We've already exceeded the time by almost half an hour.
Yeah, Sunilji must be like, okay, we're already 38 minutes ahead, but that happens to all the quizzes, so that's fine. And the next lecture, just briefly mentioning to all of you, will be on 2nd of June. That will be Friday. Now it will be shifting to Wednesday, Friday again. And it will be the essentials of radiotherapy and chemotherapy for an ophthalmologist by Dr. Vijayanand Reddy. Again, don't get disappointed, Dr. Gautam and Dr. Ashwita. You guys did great.
You guys did very well. It's just the negative markings that ended up becoming like that. So that's
the only person who knows it best is Dr. Subhav, right?
Okay.
Thank you, Jay Prasad. Thank you so much for being a part. So, would you like to say something, sir?
Shefali, excellent quizzes you are. I think you have got a good future in that too. And let me wish all of you the very best in life. And for the youngsters, the postgraduate students, please keep up that tempo and study well. And this actually helps you in your practical day-to-day clinical work too. So that ensure that you continue participating in quizzes, read up whatever you have heard and whatever you have learned in this. Good night.
Thank you so much, sir.
Good night.
Thank you.
Thank you, Dr. Mrittika, for being the great co-quizzer.
Thank you.
MSNR, we really enjoyed the quiz.
Thank you.
Bye-bye.
Okay.
Good night, everyone.
Good night.